Hi, my name is Ann McCullich. I am a licensed professional counselor, and I'm also certified in cognitive behavioral therapy from the Cleveland Center of Cognitive Therapy. I am a clinician at the Cognitive Behavior Institute here in Cranberry Township, Pennsylvania.
And my name is Jennifer Snow, and I'm also a licensed practicing counselor for the Cognitive Behavior Institute in Cranberry, PA. And today we're going to talk to you a little bit about co-occurring disorders, or what's also known as dual diagnosis disorders. The dual diagnosis disorder is when someone's experiencing a drug and alcohol issue of some kind, whether it be dependence or abuse, and they're also struggling with another mental health disorder such as depression, anxiety, or another disorder.
When you're talking about co-occurring disorders, whether that be a substance abuse associated with mental health, there is a lot of complexity and severity that goes along with that. So it can vary from something as simple as being addicted to or smoking marijuana and just having some generalized anxiety, or it could be as severe as a full-blown addiction to opioids, as well as having bipolar. It is not yet determined which comes first, the chicken or the egg, whether the mental health comes first or whether the substance use comes first. But what we do know is that a lot of times when we're talking about co-occurring disorders, the mental health piece tends to be taken care of by self-medicating through using the substance or alcohol.
Some of the statistics that we know about dual diagnosis disorders is that about 59% of people that have a drug and alcohol issue also have a mental health disorder. And of people that are diagnosed with a mental health disorder, about 50% of them also have a dual diagnosis as well. So along with that, it does take an understanding of both sides to help people really come to a place where they can achieve long-term sobriety for their substance abuse issues, and also to appropriately approach their mental health disorder.
Well, we do know that when it comes to treating a co-occurring disorder, it's very important that you have integrative treatment, meaning that you not only treat the substance abuse, but you also treat the mental health at the same time. There is evidence-based practices such as cognitive behavioral therapy, which what we do at Cognitive Behavior Institute, that allows you to dive into both that substance abuse and the mental health piece at the same time.
I'll just add on to that it is it takes a good understanding of knowing sometimes mental health issues cannot be treated until the substance abuse has ceased or has come to a manageable level that we're able to get to the mental health issues. But they do both go hand in hand. For long-term wellness, they both need to be treated.
Yeah, I think it's important that we work with the patients to determine how or what role that substance has played a part in their mental health treatment or in their mental health issues, as well as what role does that mental health play in the substance abuse. And that is something that clinicians, myself and Jen here at the Cognitive Behavior Institute, that's the approach that we're taking when we are faced with that co-occurring patient coming into our office.
I will also note that here at the Cognitive Behavior Institute, many of our therapists, including Ann and myself, have a long background in working with substance abuse issues, in addition to a background in working with mental health. So we have a balanced approach that we can take for these dual diagnosis patients and knowing what to do to appropriately help them.
It's important that with each patient that comes in presenting the co-occurring disorder, that you work with them to establish treatment goals that not only incorporate the mental health, but incorporate that substance use and abuse, and determine what they would like to work on and establish and obtain as far as the substance abuse, and the same thing with the mental health. And for more information regarding co-occurring disorders, please contact the Cognitive Behavior Institute at 724-609-5002, or you can check us out on our website at papsychotherapy.org.